Mrcem Intermediate Neurology Mock Test 2. Question number 11 to 20. Question 11. A 65 years old man suddenly develops left hemiplegia, left homonymous hemianopia, and left-sided sensory loss. His eyes are deviated to the right. Which artery is most likely occluded? A. Right anterior cerebral artery, ACA. B. Right middle cerebral artery, MCA. C. Left posterior cerebral artery, PCA. D. Basilar artery, E. Left middle cerebral artery. Let's see the answer. B. Right middle cerebral artery. Explanation. Right middle cerebral infarction causes contralateral face and arm greater than leg weakness, contralateral sensory loss, homonymous hemianopia, eyes deviates towards the lesion, neglect if the non-dominant hemisphere is involved. Question 12. A patient present with ascending weakness over 3 days. Examination reveals areflexia, bilateral facial weakness, forced vital capacity is equal to 14 ml per kg. What is the next best management? A. Observe on the ward. B. Oral prednisolone. C. IV immunoglobulin and ICU review. D. Aspirin. E. Acetazolamide. Oral prednisolone is the only treatment for this scenario. Let's see. Oh, C. It's GBS. GBS with FVC less than 20 indicates impending respiratory failure. Immediately ICU referral plus IVIG plasma exchange is indicated. Sorry guys. It's C. IV immunoglobulin. A patient with thunderclap headache suddenly becomes unconscious. CT brain shows diffuse subarachnoid blood. Which complication is most likely to occur 3 to 14 days later? A. Brain abscess. B. Vasospasm causing delayed cerebral ischemia. C. Epidural hematoma. D. Meningitis. E. Hydrocephalus only. It's hydrocephalus. E or C. Epidural hematoma. But maybe it's E. Oh, sorry, it's B. The major delayed complication of subarachnoid hemorrhage is cerebral vasospasm, usually between days 3 and day 14. Nimodipine reduces the risk. Nimodipine reduces the risk. So it's B. Vasospasm causing delayed cerebral ischemia. Question 14. A 70 years old woman develops right facial weakness, right arm weakness, expressive aphasia. Where is the lesion? A. Right frontal lobe. B. Left frontal lobe. C. Cerebellum. D. Brainstem. E. Occipital lobe. I think it's left frontal lobe, but let's see. B. Expressive aphasia localizes to the dominant, usually left frontal lobe Broca's area supplied by the left MCA. Question 15. Which clinical feature is not typical of Parkinson's disease? Resting tremors. B. Bradykinesia. C. Rigidity. D. Hyperreflexia. E. Posture instability. So it's hyperreflexia, I think. Let's see. Yes, correct. Hyperreflexia suggests an upper motor neuron lesion rather than the Parkinson's disease. Question 16. A patient presents after the road traffic accident with ipsilateral motor weakness below the lesion, ipsilateral loss of vibration and proprioception, contralateral loss of pain and temperature. Diagnosis is central cord syndrome, Brown-Sequard syndrome, anterior cord syndrome, posterior cord syndrome, E. cardia equina syndrome. I think it's Brown-Séquard, but let's see. Yes, it's B. Brown-Séquard syndrome results from hemisection of spinal cord and has the classic dissociated neurological pattern. A patient with suspected myasthenia gravis develops increased breathlessness. Which bedside investigation is most useful in the emergency department? A. Blood glucose. B. Peak expiratory flow. C. Forced vital capacity. D. ECG. E. Chest X-ray. So it's forced vital capacity. But let's see. Yes, it's correct. Serial forced vital capacity measures are essential to detect the respiratory muscle weakness and impending myasthenic crisis. Question 18. 26 years old woman develops diplopia internuclear ophthalmoplegia. Sensory symptoms separated by several months. Most likely diagnosis is A. Stroke. B. Myasthenia gravis. C. Multiple sclerosis. D. Guillain-Barré syndrome. E. Brain tumor. It's brain tumor, but let's see. Or a stroke, but it's brain tumor mostly. What about multiple sclerosis? No, it may not be multiple sclerosis. It E. Oh, it's C. Internuclear ophthalmoplegia in a young adult is highly suggestive of multiple sclerosis due to the demyelination of medial longitudinal fasciculus. Question 19. A patient suddenly develops vertigo, dysarthria, ataxia, bilateral weakness, reduced consciousness. Which artery is most likely involved? A. Anterior carotid artery. B. Middle cerebral artery. C. Posterior carotid artery. D. Basilar artery. E. Posterior inferior cerebral artery. So it may be anterior cerebral artery, but let's see. Oh, sorry, it's B. Basilar artery occlusion is neurological emergency causing brainstem dysfunction and can progress to locked-in syndrome. Question 20. Which findings is the strongest indication for urgent CT brain in a patient with headache? A. Age 30 years. B. Photophobia alone. C. Focal neurological deficit. D. Migraine history. E. Family history of migraine. It's focal neurological deficit. C. The focal neurological deficit is a red flag requiring urgent neuroimaging to exclude stroke, hemorrhage, tumor, or other structural pathology. Thank you. Key pearls. Stroke less than stroke time period less than 4.5 hours. Consider the thrombolysis after imaging. Status epilepticus, benzodiazepine first. Then second line is anti-epileptic, GBS plus forced vital capacity less than 20 ml per kg. ICU plus IV immunoglobulin plasma exchange, subarachnoid hemorrhage, nimodopine to reduce vasospasm risk. Internuclear ophthalmoplegia in a young adult, think of multiple sclerosis. Basilar artery occlusion emergency with high mortality. Brown-Séquard syndrome, ipsilateral motor, proprioception loss plus contralateral pain and temperature loss.